Eric, thank you so much for being with us today to talk a little about, I think, a topic we don't discuss enough is in working with different populations of clients, in particular, working with clients who have autism spectrum disorder,
Mhm.
working with clients on that. Thank you so much for being here.
Thank you. When I discovered your podcast, I was genuinely interested and curious in all the best ways because I think that many of the topics that you have covered, and the guests that you've have represent a really important area of the fitness professional community that often, doesn't necessarily get the spotlight.
Yeah. Yeah, I think I just always am bothered by that. I don't
Mhm.
know. I'm always like, man, why aren't we talking about this stuff? This is like really important stuff
Yeah.
in the life of a fitness professional. So before we really kick into it, let's get some background
Yeah.
on how you got into this line of work within our business.
Oh, do you want the full arc? Okay, so I was so I was one of those kids that played sports up until the point where I wasn't good enough to and wasn't interested enough to play competitively. So my thing was baseball. I kind of burnt out after I'd say after middle school, but stayed until about high school. And then after that, I think you and I spoke about this on the pre-interview. So behind the curtain, yes, there's a pre-interview, which we had a great discussion about this. Kind of the last generation. This podcast is coming out next week. I'll be 45 by that time, but we were kind of the last generation to be the outside playing all day, and scraping your knee was okay, and not to pontificate on that, but it was a very different childhood, and we were actively playing on a day-to-day basis. And so after that time discontinued, started gaining weight because I like to eat and didn't have a lot of opportunities to move around, and then decided to make a change in high school. Walked into the weight room one day and had no idea what I was doing, of course, well pre-internet, and just started using the universal machine, and then got into martial arts, and then discovered lifting, and fortunately found good information pretty early on, and that really became a big deal for me. And then in college, I discovered psychology. I was on a track towards forensic psychology, and then I discovered behavioral psychology and went to graduate school for that. And at the time, I had become a personal trainer working with general population. But in graduate school, I had a classmate who said, "Hey, I work in this program with teenagers on the autism spectrum. We've never had a comprehensive fitness program. We've done some sports stuff. It hasn't really worked out. Would you be interested in bringing your exercise expertise into our program? We'll train you in applied behavior analysis." And so when I joined that program, which I still consult with today, I was on Zoom with them. I recognized fairly quickly that there was no blueprint, like there was no best practices guide for integrating fitness programs for the autism and neurodivergent population. So it was only via an interdisciplinary model, or the culmination of different areas of practice, that I was able to put together something that really worked, because you're not just looking at, the physiology and exercise science of things like, okay, squat, push, pull, press, carry, hinge, which is relatively or comparatively easy to put together. Not saying that the science is simple, but a lot simpler than when you're, considering human behavior, and particularly nuanced human behavior at that. So over the course of working with more and more athletes, many of whom had pretty complex behavioral and cognitive profiles, I started developing, sheerly by necessity, developing the PAC profile, which is physical, adaptive, and cognitive, because I recognized that it's not, again, just about modifying or progressing an exercise, or how many sets and how many reps do you need for, sufficient volume, but how do you implement an exercise program for someone who is not necessarily attuned to the abstract nature of exercise. Like if you think about a push-up, like what are we doing this for, right? And if you're not after pecs and shoulders or sports performance, then, the meaningfulness of it needs to be built in somewhere else. And for a lot of the neurodivergent population, because it is so abstract and it's not necessarily tied to one of their goals, we have to be very considerate and empathetic of their experience in the process as well. There's also, so one of my expert level pros posted about this on Instagram the other day. There's a 16-year gap in mortality in the autism population versus the neurotypical population, and much of that is due to lifestyle. It's stress, it's health related, and your big three there are going to be nutrition, sleep, and then exercise. And the exercise component of it is just simply not addressed enough, and that was kind of the impetus for Autism Fitness existing and creating a certification.
Awesome. Thanks for that. And I really appreciate that. So let's kind of like level set here because a lot of trainers, fitness professionals that listen to this actually may not even know what autism is or
Yeah.
autism spectrum disorder. So let's do an operational definition.
Yes.
And so that we know what we're talking about here and people know what they're listening to. Yeah.
Yeah, yeah, absolutely. So autism spectrum disorder is a neurobiological diagnosis. It can be called a condition. There are many um, self-advocates or individuals who actually use their diagnosis as a strength, or they're proud to identify as autistic. So it really ranges, and the spectrum continues to grow outward. But at a very basis, individuals on the autism spectrum tend to have uh, challenges with socialization, with cognitive processing, in as much as abstract ideas or concepts. They tend to be very literal. They often have very narrow interests. So I have a lot of athletes who want to talk to me about trains or
Mhm.
maps or particular TV shows for much longer and much in depth than a neurotypical person would, and oftentimes there's the phenomenon of talking at versus, actually having a conversation. So there's certainly the socialization component. There's a cognitive processing component, so it may take individuals longer to learn a task. And then there's also a motor planning deficit aspect to that for a lot of individuals, and that's why we have such prevalent therapies as occupational and physical therapy that are kind of oftentimes in conjunction with speech therapy, kind of the trinity of therapeutic integration. And in addition, actually, it's a quad because you have behavior therapy as well. So self-regulation is another big one for individuals. They may get stressed or anxious really easily, both from the perspective of social situations, but then with everyday tasks sometimes. Not having the capability to follow through with a particular daily activity because the sequence breaks down. So we have the social and the cognitive challenges that typically come with autism. And again, it's such a vast spectrum. So someone could be listening to this who's diagnosed on the autism spectrum and saying, yeah, some of that applies to me, some of it doesn't. So because it's such a gradient scale. I mean, I have individuals whom I've worked with or I'm working with now who need support in their throughout their day, so that they are safe and able to complete rudimentary tasks, from tying their shoes to brushing their teeth to washing their hands. And then I have individuals who drive themselves to the gym to train with me, but at the same time definitely have some uh, social nuances or tics or deficits that oftentimes they will mask. So in the first 5 minutes of speaking to them, someone might say, "Oh, I don't think they have a diagnosis," but you speak to them for 15 minutes and like, okay, there are some nuances here that I can recognize.
Right.
Yeah.
So what would you say would be more common for a trainer or fitness professional to work with someone who's would be much more higher on this more high functioning? skill maybe you wouldn't notice as much, or someone that needed a lot more support, help that you've seen?
Oh, that's a great question. Again, it varies so much. I think what happens when you have someone who is diagnosed, like right now, the diagnostic criteria, you're challenging, behavioral profiles and limited capabilities. You're looking at based on the Diagnostic and Statistical Manual of Mental Illness, the latest version. You're looking at a level 3 autism diagnosis where someone does need a lot of support. We may see um, some aberrant behaviors of, self-injury or aggression, which are, common enough to note. But then on the other side, I've had, um, autistic individuals reach out to me who say, "Hey, I'm working with this coach right now, and the programming is fine, but they just don't really get that I don't get, the way that they're coaching me right now," which is fascinating for me.
Yes.
So I think I'd love to give you like an aggregate. I'd love to give you like the average. I don't know if the average is average. I would imagine this, and I could be wrong, but I would think most trainers are being approached by families of adolescents or teens who would be diagnosed like a level 1 or level 2 autism, where there aren't a lot of significant behavioral concerns, because typically when there are, those are the most pressing issue for a family, and I would understand that. So it would probably be an individual who's having a lot of difficulty like fitting in
Mm.
into a social or a peer group. But the family, and I'm saying family because typically, individuals under 18 or their families who are reaching out to a trainer, who say, look, I just want them to, get fit, and I understand that this is important. So I would say it's probably an individual who may be less capable expressing themselves verbally, but um, I know that there are some very high level, competitive athletes in the strength space who are diagnosed on the on the autism spectrum too. So when they approach a coach, having these tools and these capabilities and these skills at your disposal as a coach is not just autism specific, but it definitely helps a lot in that arena.
Yeah, most definitely. And it's interesting you and I are talking because I came across about what your work is, and I thought, man, this is so interesting because after almost 25 years of training, I have started working with my first person who has let me know that they are on, have autism spectrum disorder,
Yeah.
and very proud. They're very proud of like
Yeah.
talking about it and the whole thing. And I was like, man, this is so weird how this is lining up. I'm just entering into this area all these years later. Now I'm talking with Eric. And when you told me in our pre-interview about I think you had talked about the athletes and the coach, the programming's fine, but they just don't like get me, how to
Yeah.
talk to me.
Yeah.
And I think that's something a lot of trainers would this is something that we got to dive into this because this is a really interesting topic of like programming is not everything. And this is even just not autistic clients, but just neurotypical clients. Like there's this other side of communication, but especially with autistic clients, I noticed that was the client I'm working with. She's like, hey, um, I work really hard all day to try to like, you know, s- keep myself together.
Mhm.
But when I come here, I wanna just be able to communicate like how I can communicate, like,
Yeah.
naturally
Yeah.
to me. So let's talk
Yeah.
more about that.
That's beautiful, and that's a big conversation in the autism space right now is masking, because now the diagnosis has opened up so more, and I think, that there's certainly challenges and things in the mainstream that are, less desirable, but I think that overall, culturally, it's become in the zeitgeist, because autism is spoken about so much, and again, there are definitely some issues there. Um,
Sure.
but but overall, someone says they're autistic now, and it doesn't have the same connotation or some of the same stigmatization that it had, 5 or 10 or 15 years ago. So the phrase that's become prevalent in the autism space right now is masking, and there's a lot more research on this now. Individuals, oftentimes, females, because for women, autism often shows up very differently. So the idea of masking is almost is concentrating that individual concentrating very uh very diligently, and takes a lot. You can imagine it takes a lot of energy to blend in as neurotypically as they possibly can throughout as many social interactions and situations throughout the day. And, you have to appreciate the amount of trust that client put into you to say, look, I'm trying all day to kind of pretend that I have this together, and I don't. So when I get here, just let me be me, really. And just let me, I'm going to do, I haven't said it for years, but the a lot of our autism population, they do the weird stuff in public that we do in private as neurotypical people.
Mm.
I'll walk around the house singing songs to the
Yes.
cats and dogs, and to my wife. And they're bad songs. They're not good um at all. And and
Yeah.
some of them are um you know, honoring other songs, and some of them are just straight up, wrestling theme songs. So I'm going to do that
Yeah.
in private for the most part, every once in a while public,
Yeah.
but you think about, not having that veil of, public and private personality too. So, your client was saying, just let me have this moment in public during,
Yeah.
during my week. That's a big deal. And coming back to your point earlier of um, you know, programming, programming often isn't everything. That you could have, and I'm imagining that your programming is outstanding, but you could have mediocre programming, but if you make that connection with the athlete, then they're going to stay with you. And we see that in the neurotypical world, but not to say that the benchmark there should be, okay, I can have I can I can be doing Bosu ball curls and it's fine because I have a connection with my athletes, because no, but at the same time, making that connection with the athlete, building the trust, building the rapport, them knowing that you consider them, an equal is a big deal. And of course, being decent at programming and understanding exercise
Yeah.
science helps a little bit too.
It does help. But it's interesting, like with this, I seen was working with this person. I love it. I love working with this person. Probably
Yeah.
because it's just so raw and real. It's
Yeah.
so there's like no um barriers. Like the communication is so honest.
Yeah.
Often what I think sometimes with very neurotypical people is there's a masking as well. There's not a lot of honesty. It's like, well, I don't want you to know that I could be thinking this, or this may seem weird to you, so I'm just going to kind of make up this personality of myself or not give you all of me. Whereas, especially with this person, it's like, no, this is me. Like, and she always says, "Because I'm this is I'm gonna say a lot of crazy stuff. You just have to deal with it. Like this is just how it is." And she goes, "My favorite thing about our time together is like you don't find this crazy. Like you think
Yeah.
this is all right." I'm like,
Yeah.
yeah, I
Yeah.
just want you to be yourself. I want that for anyone. Like,
Right.
but for especially you, if you feel like you're all day, I can't imagine what it's like to spend so much effort trying to
Yeah.
blend in and then be exhausted at the end of the day and just please let me be at my baseline, where I'm at.
100%. And think about, you everybody is a little bit different with different people in different situations throughout the day. Imagine doubling that effort. And I'm just, saying doubling it for the sake of it being easy, but imagine doubling that mental energy to try to, that is exhausting. That's
Ah,
exhausting.
exhausting. Yeah. So with your work, so as you started developing, like obviously you said there was really nothing in place.
Yeah.
Let's start going through what kind of the protocol generally that you developed
Yeah.
and kind of the takeaways that we can give other fitness professionals as they approach working with people in this population.
Yeah. So I'm going to give you, we're going to go bro science. I think I, there's a lot of good science in bro science, by the way, but I'll go bro science here. So there's two sets of three, right? then the two sets of three. So I had mentioned earlier the PAC profile, which is the methodology that we use in autism fitness that I developed, out of necessity, and then we utilize as kind of our standard operating procedure in the certification. So it stands for physical, adaptive, and cognitive, and those are the three skills that we need to assess and then address in our programming from day one to continuum. So physical is just the exercise itself. What is the exercise performance for that athlete? Are they at standard? Like, can they do 3 sets of bodyweight squats below parallel with good tempo? And if not, how do we modify it? If they can do it, how do we progress it? Progression, as we know, is like the easiest thing on earth. Like, add sets,
Right.
add repetitions, add weight. Like, don't make it more complicated than it needs to be. So that's the physical. So we're always, as coaches, we're assessing the physical. That's, what we do. How is this performance? Is there going to be a, breakdown in technique? Are there any, energy leaks or compensatory movements, et cetera, et cetera? Adaptive is really important because then we get into motivation and focus. How motivated is this individual to perform this exercise right now? And it really is a question of, are they doing it or are they not doing it? So you can look at it almost as like a binary, like, are they completing the set of 8, medicine ball push throws, or are they doing 4 of them and then getting dysregulated or wandering off? Because that's going to inform how I need to, approach them, and incentivize it or program the language that I'm going to use. And then we have cognitive, which is not low or high functioning thing. I'm glad those terms are starting to be extinguished,
Mm.
but it's more, how do we communicate with this athlete? How do they communicate with us? And then what is their kinesthetic awareness? So if I give them a mirror replication. So I'm demonstrating the exercise because they've never, seen a cable row before. So I'm demonstrating the cable row, and then I hand the handles off to them. I need to see their motor imitation because that's going to inform me on how much support they need when they're doing that row. If they're, coming off of their 4 feet and leaning way back and like falling backwards when they're doing the pole, obviously they need more support or a little more careful instruction. But if they're nailing it the first time, and maybe I'm adjusting the weight a little bit or I'm adjusting their foot position and fine, but they got it, okay, cool. So we need less on the kind of onboarding or instructional side and more on the, okay, we can just like kind of stand back and let them do it independently. So those are the first 3, but those are the most important 3, the physical, the adaptive, and the cognitive. The second 3, and these are really, really critical from the standpoint of developing empathetic coaching, is you really have 3 areas of motivation to engage in exercise, like anywhere. You have body composition, gain muscle, lose fat, whatever. You have sports performance, so I want to get faster, more powerful, stronger, more endurance for my particular sport, and that could be competitive or non-competitive. It could be, wrestling, kayaking, cave exploration, baseball, basketball, rugby, whatever. And then the third is life enhancement. So a lot of, general population is a combination of, body composition and then life enhancement. I don't want my back to hurt anymore. I don't want to get, I don't want to be winded when I'm going up and down stairs, that kind of thing. The reason it's so important to acknowledge these 3 is those 3 are usually absent for many of our autism population. So when a coach says, well, do this exercise and you're going to get a lot stronger, that athlete doesn't care because they don't have a reference point or a context for that. One of the things that you had mentioned earlier in, loving the fact that that your interactions with that athlete were so raw and so real and so honest is a big deal. Like, I'm the founder of Autism Fitness. I've been doing this for 20-something years. When I get a new athlete in, they do not care who I am. They don't care about my credentials, that it's just like, why am I here? What am I doing? So I do not have any cushion of pretense ever with any of my athletes because their parent could tell them on the ride, or they could look me up and they're like, it's, the creator of this, system. It's like, they don't care. They don't care. It's like, who are you? What are you making me do? Like, all right, so I have the same challenge now that I did when I first started, like the first week that I started doing this, I have the same challenge now with a new athlete because they're not coming in saying, "Oh, I get to work with like the founder of," it's like, "Who are
Yeah.
you and what is this and why am I here?"
That's right. I love that. It's we talked a little bit about that too in the pre thing, and I just think it cuts through all the stuff.
Oh yeah.
I guess I just have a huge appreciation for that, kind of in a strange way. It's just like I don't also have to play some role either. On
Yeah.
my side, I can be like, "Oh, good, we can just get to the point of this." It's like you talked about sometimes they would, a person may talk about things for a really long time, like trains or whatever, or different
Yeah.
things, and I noticed I know, man, that resonated with me so much. It was like movies. This person
Mhm.
wants to talk about how they watched 21 seasons of a show
Yeah.
obsessively over
No.
and over and over again. Like, why
And then
just
after they
talking?
watch the 21st season, they go back again and start with
They
season
go
1.
back, oh, I saw
Yes.
something different
Uh-huh.
on this season.
Yeah.
And oh, the fifth season. Oh, you got to go back and watch the fifth season. And we're talking about it. And then the greatest thing they said, it's interesting you want to keep talking about this, like that you keep indulging this. I said, I find it fascinating that someone wants to do this. I was like,
Yes.
so bring it
Yeah.
on, man. Like, like it's
And
different.
and
I
that's
enjoy it.
but that's, getting into somebody's world also. It's like
Yes.
that's the empathetic point of it. Is like it's funny, I had an athlete a couple months ago who I love working with. And at one point he's a smart guy. He's 15 years old. So of course,
Yeah.
the sarcasm is
Yeah.
just
Yeah.
is just dripping out of his brain and through his mouth. But at one point, he said he talks to me a lot about trains. We talk a lot about trains and very specific trains, only trains in Europe, and then how some of them are like awful, and these companies are.
Right.
So at one point, he goes, yeah, he said something to the effect of, I'm paraphrasing, like, "Oh yeah, but you're paid to care." And I said, "You know what, dude? Sometimes I am paid to care. But in this instance, I care that you care, and that's why I'm interested." And that was the truth too.
Yeah.
You know?
Yeah.
And then I got to tell him how awful the Long Island Railroad was that I had to ride for 20 something years.
Yeah, you start commiserating on these things, right? You
Right,
just that's
exactly. And then
real.
you make a connection too. And it's like, oh, someone's, listening to me and not just waiting for me to be done.
Yeah, exactly. I found it actually refreshing. I was like, oh, it was like they weren't self-conscious about it. They were just like, no, no,
Yes.
I watched this show and I'm telling you, I love this show. I've watched the 15th season 20 times. I'm not
Hmm.
embarrassed by this. I'm just
Yeah.
telling you I do this. I'm like,
Yeah.
great. Tell me about the 15th season. I'm
Yeah.
like, it's
Can
actually
I
pretty
ask you
phenomenal.
follow-up questions or do you just want to
Uh,
like, yeah.
just want to roll with it,
Yeah.
So I, yeah, I think that's I it didn't throw me off. It was just kind of like, this is kind of funny, but also
Yeah.
I'm so curious by this. And they actually like that. It was like, oh, you don't mind this? I'm like, no,
Yeah.
like you don't mind. I don't mind it. I'm interested in
Yeah.
you. Yeah.
Yeah. Oh, when you make it, you've been in the industry long enough. I think we've been in the industry for about the
At
same
the
time.
same
But
time, pretty much. Yeah.
when these things come up, it's like, oh, make it whole person centered, and make it
Yeah.
individualized. It's like, okay, great, we're saying words, we're typing words, words are happening. But what is that actually like? What is the take? What is the action associated? With
Yeah.
that. What is the
Yeah.
action associated with taking a whole person approach?
Right.
It's like,
Right.
okay, what
Exactly.
great. It sounds nice. It looks
It
good.
does
I'm
sound
glad that you
amazing.
it sounds amazing. Or yeah, my least favorite hyperbole right now is super excited. Everybody, no one's
Oh,
excited
super.
anymore. No, I didn't know if you knew this, Dr. Darian. No one's excited anymore. Find me someone
No.
on Instagram or YouTube who is excited but not super excited about something. I'm super
I
excited
didn't
about
know
this
this.
bar of soap. Start everybody. I'm going to drive everyone who's listening to this crazy. Find me someone on the internet who's only excited, not just super excited.
But not just super excited.
But it
Yes, that
can't be no
excited is
only rudimentary general excited, normal
yeah.
level excited.
Right, that doesn't exist anymore, right?
No.
Like,
No, you
you
have to be
actually, it's a
super
lower level existence if you're just excited. You have to be super excited. Wow.
I
So,
gue
it's
I
sort of
guess if
like
you're, yeah, off labeling Adderall, you can be super excited.
yeah, maybe, yeah. So, the communication factor is a pretty
Yeah.
big part in
Mhm.
working and understand that there may be like a communication aspect where it's more maybe longer tenured in terms of how much you're gonna talk about something. And also being like, "Hey, I just kinda don't care. I'm gonna talk about this," you know?
Yeah, oh, yeah, totally. Well, generally speaking, the athlete, they can talk as much as they want. My rule is as long as you're doing the thing. I've one athlete
Mhm.
who is 16 now, and fortunately, we're in the gym when a lot of people aren't there. He drops F-bombs and is making up his own songs, and then he keeps looking up, like, the eyes keep coming up at me like I'm gonna do something, and I know he just wants the response, and I'm like, I 100% guarantee that he can't do this around his family or
Yeah,
peer. Like,
yeah.
it's gonna be a it's gonna be a problem. So he's doing it around me, and then he looks up at me, and I'm like, I don't care as long as you're squatting. Are you squatting right? Okay, great. I don't care. Don't care.
Right.
Great. As long as it's not disruptive and you're not screaming. If he were standing on top of a plyo box,
Right,
screaming
right, right.
obscenities. As
Yeah.
entertaining as I would find that, like, that would be a no-go, but he's, like, under his breath
It would be
muttering,
entertaining.
yeah, while he's doing, like, an overhead press. I'm like, "Dude, you okay, great, great." But, for him, like, communicate all you want as long as you're doing the thing, but the big thing, and this is something that I've actually spent more time in the certification curriculum. I'm in the process of revamping the curriculum, and we're spending more time on this, is the art of not overcoaching and not using
Uh,
too much language, because it's a thing that we find gets in the way of athlete performance, particularly in the early stages of exercise. But more than anything else is going into explaining mode versus labeling the exercise, demonstrating it, and then just letting the athlete do it. Because once they're doing it, I can figure out what needs to be done as far as modification or progression or even, little tweaks and stuff like that. But if I stand there explaining, okay, there's a band row, so first you're gonna get your feet together, and then you're gonna, hold your
right.
torso straight, and then make sure this and make sure that, like, nope, not happening. You're losing them. You're gonna lose anybody that way. So
Yeah,
it's
yeah,
keeping you our input needs to be concise and precise in order for their output to be as best as it can possibly be.
yeah. I 100% agree with that and almost any population, but in my very limited experience with, this particular person, it's I never realized it. The way you said it made so much sense. Like, I noticed when I'm coaching this person, I'm saying very little. I'm like, "Oh, okay, we're gonna do this lunge. I'm gonna step back into this reverse lunge, stand up. That's it." And they're like, "Okay, good." And I remember one time I tried to explain it a lot, and it was just like, it was like, I was like, "Oh, I can't do." I
Yeah,
could just see by the face. I said, "Oh, I can't do this." I need to just
yeah,
like make it a very small portion of the entire experience. Okay, we're doing this.
yeah.
Now let's move on. You know?
Yeah, it's let the sooner you can get the experience to be the teacher, the better off you set yourself up as a coach, because then you can coach the actual exercise instead of coaching someone to think about the exercise.
Yeah. Yeah. Do you ever notice? I'm curious about this. Is this part of your kind of standard operating procedure, understanding it? I've noticed, at least in this case, that when you talk, when you get on with someone, you meet with them, hey, how's it going today?
Yeah,
How are you feeling? It's like opening a huge can of worms. In particular, with this, like, how's it going? Not good. It's been a
yeah,
bad day. Yeah, I just don't feel great. Whereas I feel like more of your neurotypical people, they will mask that. I'm
yeah,
okay.
yeah,
It's all right. It's fine. It's fine. Like, and whereas the other person is like, oh no, no, it's bad. It's actually bad. Like, I'm like, oh, okay.
yeah, yeah. It varies a lot. I find I definitely resonate with what you're saying. And this is all based on, like, personal experience. When, the
Mhm.
common, like, colloquial, "Yeah, hey, how are you doing today?" I usually go with, "How are you feeling?" And then, how are your, shoulders? How are your hips? How are your feet? I'll ask
Mhm.
specific questions. And I have a rule with my athlete. I only in my own practice, I only work with athletes who are 12 years old, 12 years old and up. So, some of them are in school, some of them, my older athletes, obviously aren't. But I have a rule that I never ask about school unless it is brought up to me. And I wait the other I don't know if it's a rule, but a general practice. I won't start asking questions until we've already started the session, or in
Mhm.
between exercises, because I'm probably going to get a better answer versus it's almost, coming back to masking, like the neurotypical protocol is, "Hey, how are you?" Like, man, I injured my thumb at jujitsu last week, like almost a week ago, and I'm walking around telling everybody, if someone asks, "Hey, how you doing today?" "Oh, I'm fine, I'm great." But then if I'm actually speaking with someone longer than 5 minutes, I'm like, "Yeah, my thumb is messed up right now. I'm waiting for it to
Mhm.
heal." So I think the the truth, or something that's more honest usually comes out a little bit. Even if you have a good rapport with that person, it'll come out later. So I
Yeah.
don't even bother in the beginning. I'm like, "Okay, how do you feel today? Are you good? Everything
Yeah.
good? All right." And then I'll figure it out later.
Yeah. That makes a lot of sense. What are some other takeaways for trainers, fitness professionals, in approaching working with someone who has autism that you think would be pretty helpful?
Um, it went. So I'm going to say something that is going to sound cliche, but is
Uh-huh.
really important, especially from like an exercise selection and programming standpoint. You really need to make it about them. So I take a
Mm.
very basic and fundamental approach to strength training and fitness for my athletes. It's like, okay, squat, push, pull, carry, hinge, rinse and repeat. It doesn't matter how many cool different variations of an exercise or different patterns you want to utilize what is going to be most generalizable for that individual. So if you have an athlete who can't do a bilateral squat yet with body weight and go below parallel, um, without assistance, then why are we starting to introduce a lunge, or why are we starting to introduce a rear elevated split squat, which I refuse to call a Bulgarian split squat because it's not from Bulgaria, but anyway, or like an RDL. So
Yeah.
it's not about the vast array or library of different exercises, or like what looks cool. It's about what is legitimately going to enable that athlete to thrive outside that session. And it's going to be like, you're really not going to go wrong with the basics, because they need those. It's like prerequisite skills, with
That's
anything
right.
else. So do that. Okay, so that's one of the things when 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 it is said, "Oh, everybody's different and everybody needs, different programming." That's not true. All of my athletes squat and push and press, like all of these fundamental movement patterns. And then once they get good at them, then we can talk about variation. But if they can't
Yeah.
yet, why, like, a 12-year-old's program is not going to look that much different than a 27-year-old's program, unless there is a distinct need for it to look different. And that's it.
Um, yeah. And you know what's interesting is I have a 10-year-old that I work with, and we do a lot of very similar base level exercises, but the difference is the maturity level.
Yeah.
And some of it has to be a little different, a little more. How could I? So, for instance, we're doing a squat, and I had to make it feel more like a cartoon in a sense for
Yeah,
them
you're
because
you're
that's
gamifying it. Yeah.
yeah, making it
Yeah.
more good because that's how they think. They're like, "Oh, that's fun. How can I make this more fun and interesting to me?" Because regular squats are just boring to me.
Yeah.
And
Well,
this person has ADHD also, pretty high level. So it's like, okay, that their attention span's really short. I have to make this like really entertainment fun while also doing the basics. Whereas, with someone else, like 27-year-old person, it's much less about those other things, the maturity part of it there. But we're still doing very similar stuff. It's just my presentation of it, and kind of even also my personality of it is a little bit different within it.
Yeah. Well, most 10-year-olds don't care about having a sick quad sweep. It's just that,
No.
that's just what it is.
No.
Like, it's not like, oh,
Right.
I need to get these striations in my hamstrings. That's so it's contextualizing it and saying, okay, well, for this 10-year-old, this is age and developmentally and individually appropriate. That's where the individualization, comes in. I have one athlete who I work with who's in his 30s, and when I had him push the sled, at one point he was Star Trek obsessed for a while. So when you were talking about, watching 21 seasons of something, he would
Yeah.
watch his Blu-ray DVDs of all of the Star Treks on repeat, like year after year after year after year. And I
Yeah.
remarked to him one day, hey, the sled, like it was the classic, Prowler sled wedge design.
Right. Right.
I said, that looks a lot like the, the Starship Enterprise. And he really dug that
Yeah.
too. So now every once in a
It's
while,
awesome.
it's let's put when he's doing, 2 round trips across the turf of the sled at the end of his session, it's okay that, the Enterprise is going into the docking bay. And he really,
Right.
he digs it because I'm contextualizing it for him. And it's also like, it's it's age appropriate, but it's also individual appropriate. Like, if he's 37 and he was into like Blue's Clues, could I do that? Yeah. Would I do it, a lot more
No.
low key because it could be stigmatizing? Yeah, yeah, sure. But the Star
Right.
Trek thing, I mean, there are plenty of, you know, Trekkies out there who are, in their 80s and 90s. So I'm
That's
sure it's
right.
cool. Um,
Yeah. I love that.
so yes, so I think what we're talking about is the same thing. It's the nature of how do you take the basic chemical, the atomic structure of physical fitness, if we're looking at it from a, strength training perspective, and apply those different, chemicals or tools or pieces to different individuals to get ultimately like the same results, but in different ways. And how do you contextualize it and increase the motivation to participate based on what their interests are and what's motivating to them, not what's motivating to us as coaches. Like, yeah, if I want to, if I have an athlete who comes in and wants to, get jacked and, show me their muscles, like, yeah, let's, let's do it. But that's not the majority of the athletes who I, see on a regular
Yeah.
basis.
Same. Yeah. It's, man, fascinating. Any final thoughts or anything you want to leave the audience with about working with this population, and just like summarizing the information, just so people have a little better comfort level and understanding of how to be approach uh, working with
Yeah.
people in this pop.
Yeah. Yeah. I think, coming back to the idea that there are 3 distinct areas of capability to look at: those physical, the adaptive, and the cognitive. And also, I am perfectly okay with the notion or the reality that, like any niche population, not every coach is going to have the desire or some of the innate, you know, skills. That's okay. I'm very unskilled in many things. To work with this population in a way that is conducive to success. But those who are, I spoke earlier about that 16-year gap, and that's something that's real. And if we think about underserved segments of the population for whom something like this makes a literal, again, staying away from hyperbole, but a life changing type of difference for them. That's what you can, potentially, if you're not doing it already, that's what you can provide to this
Yeah.
population. And anybody who's been, I think, someone who is, I would rather have someone, in my program, or someone who reaches out to me who says, I want to do this, but I want to do this right. And I know that I don't really know what I'm doing just yet, versus someone who's just like, oh no, I got this. Like, I train pro athletes. I've got this. or or I don't I a false sense of confidence is going to be
Um,
a major hindrance to success in
yeah,
this because to what we were talking about for a good percentage of this conversation, you can't BS this, right? Your athlete's
no.
going to see right through that, or it's going to be ineffective. So you do want to have those tools to be able to utilize. But this is I'm trying to ensure that this is an emerging and growing market, um, for this population, because the need is out there, and certainly the desire for programming, from families and individuals is continuing to grow as fitness becomes more of a topic of conversation. The question is, creating a standard. How do we create a standard of
Mm.
practice for people who want to do this? Um, I think that's it. I don't know if that encapsulated. I think that's maybe 3 capsules instead of 1.
I think it was great. Honestly, I was very drawn to this conversation and meeting you in the our discovery call was awesome. I was like, man, Eric's so
Thank
awesome.
you.
It's going to be such a great conversation, seriously. And this conversation just deepened my respect for you. You seem like an
Thank
awesome
you.
guy, Eric. Seriously, someone I would love to be
I
around.
have
And
my moments.
we all do, man. But this is a really, really important topic to me. But I think a lot of people, and again, as you know, my podcast, I want to focus on things that are not discussed that much. So I'm
Yeah.
glad we're going to give light to this. And the good thing, I hope that encourages you is that this will be in my classes that I teach in colleges, this podcast. A lot of trainers who are going to become trainers are going to listen to this, current trainers. So we want to make sure that what you're doing is given a lot of light. And so thank
I
you for what you do.
I am grateful for that. Thank you, Dr. Darian.
Of course, man. Well, so how can people just last thing connect with you? It's the best way to know Eric, via connecting with you online just to get some more information.
Oh, easy. Autismfitness.com for the site and all the information about the certification. I'm very active on Instagram and YouTube. So Instagram, it's the Autism Fitness, and then on YouTube, I put out a long form video every Tuesday. I put out a bunch of shorts throughout the week, and yeah, those are the main one. Instagram, I am planning to do more Instagram lives. You and I should definitely do one at some point because I just like the conversation because it's not something that obviously you
Right.
can, just fit into, a 5-minute segment because there's so
Yeah.
many different things to discuss in it. So yeah, autismfitness.com, the Autism Fitness on YouTube and Instagram.
Awesome. Eric, thank you so much. I really appreciate you, man. I'll be in touch, man.
Thank you. I appreciate you.
Bam.